This is discoid eczema, also known as nummular or discoid dermatitis, and it is a long-term skin condition that causes skin to become itchy, swollen and cracked in circular or oval patches. Without treatment, discoid eczema can last for weeks, months or even years, and it may keep coming back, often in the same area that was affected previously. In this video, we're going to cover causes, potential signs and symptoms, treatment, and when to seek medical attention, all of which are split into chapters and timestamped to help you navigate your way around the video. So first of all, let's talk about causes of discoid eczema. Well, the cause of discoid eczema is unknown, although it may happen as a result of having particularly dry skin. When your skin is very dry, it can't provide an effective barrier against substances that come into contact with it. This could allow a previously harmless substance, such as soap, to irritate your skin. Now, it's important to look carefully at all the chemicals in cosmetics and toiletries that may have come into contact with your skin. Contact dermatitis, a type of eczema caused by coming into contact with a particular irritant, may have a role in discoid eczema. Now, some people with discoid eczema also have a history of atopic eczema, which often happens to people who are prone to asthma and hay fever. However, unlike atopic eczema, discoid eczema does not seem to run in families. Now, in terms of other possible triggers, an outbreak of discoid eczema may sometimes be triggered by a minor skin injury, such as an insect bite or a burn. Some medicines have also been linked to discoid eczema. Now, you should not stop taking any prescribed medicine without talking to the doctor who prescribed it for you, even if you suspect that medicine is the cause of the underlying discoid eczema. Dry environments and cold climates can make it worse, and sunny or humid environments may make your symptoms better. So what are some potential signs and symptoms of discoid eczema? So discoid eczema causes distinctive circular or oval patches of eczema which look like this. It can affect any part of the body, although it doesn't usually affect the face or scalp, although this is not a hard and fast rule. Now, the first sign of discoid eczema is usually a group of small spots or bumps on the skin. These then quickly join up to form larger patches that can range from a few millimeters to several centimeters in size. On lighter skin, these patches will be pink or red, but on darker skin, these patches can be a dark brown or they can be paler than the skin around them. Now, initially, these patches are often swollen, blistered, and ooze fluid. They also tend to be very itchy, particularly at night. Over time, the patches may become dry, crusty, cracked, and flaky. Now, something that is really important to mention is that the center of the patch also sometimes clears, leaving a ring of discolored skin that can be mistaken for ringworm. If you're not sure which one you might have, it's always best to see your pharmacist or health provider. But if you've got one of these lesions and it isn't responding to antifungal medications like ringworm mite, then it could be discoid eczema. Now, you may just have one patch of discoid eczema, but most people get several patches and the skin between the patches is often dry. Patches of discoid eczema can sometimes become infected. Now, signs of infection can include a whole host of things, but things such as the patches oozing a lot of fluid, a yellow crust developing over the patches, the skin around the patches becoming hot, swollen, tender, or painful. Potentially you might feel sick, hot or shivery, or just generally feel unwell. Now, if you experience any of these symptoms, then you should speak to your doctor or your pharmacist, as you may need antibiotics depending on how bad the infection is. Now, talking of seeking medical advice, when else should you seek medical advice about suspected or potential discoid eczema? Well, if you think you have discoid eczema, it's best to speak to your doctor because they can recommend a suitable treatment. And like I mentioned before, you should also seek medical advice if you think your skin might be infected. Now, you may need to use an antibiotic cream or in severe cases, take antibiotics as a tablet or capsule if there is infection. In terms of diagnosis, a doctor should be able to make a diagnosis simply by examining the affected areas of skin and asking you a few pertinent questions. In some cases, they might arrange some other tests, or they might refer you to a doctor who specializes in skin conditions known as a dermatologist if they're slightly unsure of the diagnosis, or if you need something like a patch test. And for more information on patch testing, please check out this other video on my channel. Finally, What about treating discoid eczema? Well, discoid eczema is usually a long-term problem, but medicines are available to help relieve the symptoms and keep the condition under control. Now, treatments include emollients, which are special moisturizers applied to the skin to stop it becoming dry, and these are essentially the main form of treatment, and they're really important. The other option are topical steroids. These are ointments and creams containing a steroid that is applied to the skin and may relieve severe symptoms. They're typically good for short-term use, but if you do use them long-term, it can result in the skin becoming thin, cracked, and there are a range of side effects associated with long-term steroid use that you need to be aware of, and I would recommend you speak to your doctor about this. You might also want to use antihistamines, medicines that can reduce itching. There are also things that you can do yourself to help, such as avoiding all the irritating chemicals in soaps, detergents, bubble baths, and shower gels. Additional medicine can be prescribed if your eczema is infected or particularly severe, like I mentioned. Now, occasionally, areas of skin affected by discoid eczema can be left permanently discoloured after the condition has cleared up. If you've got any concerns about skin lesions, it's always best to speak to your own health provider, and I've included lots more information on discoid eczema in the description box of this video, which I'd encourage you to check out. If you found this video helpful or useful, please feel free to give it a thumbs up, and also if you've got discoid eczema, please leave your own experiences in the comments section of this video, which I'm sure is going to help others. Thanks for watching, and bye.